Welcome back to Healthcare Consumerism Radio. This is Brent Macy and Doug Field coming to you from the studios in Sandy Springs, Georgia. Doug, kind of two good segments there, talking about engagement, which is very key to an employer's overall strategy to implement their benefit plans, and then really looking at the HSA space, big exploding space, as John and Eric mentioned. Kind of your thoughts on the last two segments?
Well, just going to the last segment, it kind of verifies what we've been talking to the industry about and hearing from the industry, is that there's a lot of discussion around exchanges, but this is going to be a low participation period and a look-and-see period. The other parallel that's exploding is the adoption of full replacement HSA and high-deductible programs. Mm-hmm. Is that if I'm an employer, I'm seeing that that's the option I need to move to, and then surround it with, good tools like kiosks, good engagement tools, gamification around your health, around your benefits enrollment, et cetera.
Yeah, one of the things that I found interesting, and we had talked about it, years ago, was when HSAs were coming in to be vogue, we were actually looking at it saying, hey, there's got to be enough money in the accounts to make sure that everything that the government's not going to write it out. So it looks like there are enough accounts there. Money in the accounts that the government's going to stay, away from HSAs, and so that is a good thing.
I think that's a very good thing, and this segment's going to be very interesting, talking about another slice of the pie, and that's medical tourism, both international and domestic. And joining us today on the program is David Boucher, president of Companion Global out of South Carolina. David, good morning.
Good morning.
Hey, I haven't talked to you. Nice to talk to you again. We haven't seen each other in a little while.
No, we have not, unfortunately.
Yeah, nice to have you on the program. David, been a lot, medical travel, both international, particularly international, been around for quite some time. In some places neglected. I think the last couple of years, there's a lot of attention being paid to it as a very legitimate, cost-saving tool to employers and consumers, both domestic and international. Can talk to us about Companion Global Healthcare's position in this space, and then talk about where you see the trend lines moving.
Sure. Well, thanks for the opportunity. We our company's been in existence since 2006. We incorporated as a wholly owned subsidiary company of Blue Cross and Blue Shield of South Carolina in 2007, and our basic business focus is to contract predominantly with self-insured employers, and so we do that. We contract with a number of self-insured employers in a number of states around the country, and really help them to understand the value of medical travel, and get them to but help them to understand that maybe, just maybe, that the best care available to their employees and their dependents might not be at the local hospital. It actually might be at the local airport. And that's a significant change. You mentioned domestic medical travel. We're not very involved in that, but that certainly has been a significant movement in the last, say, 2 to 3 years as well, right? We've had large employers like Walmart, like Kroger, like PepsiCo and Lowe's that have all implemented with incentives for their employees to travel to places like Johns Hopkins or the Cleveland Clinic or others for surgical care. And so we're convinced that that through increased transparency, the more and more that both employers and particularly consumers / patients understand, the more that folks, the more mobile I think people are going to become about traveling for care, whether it's internationally or domestically.
Yeah, I think I think most would look at domestic travel as that first step towards, it's easier for me, a consumer in Atlanta, to feel comfortable about flying to Johns Hopkins than maybe Istanbul. So if I take that first step, now my eyes maybe open up to the opportunities of going to Istanbul or going to someplace international. Would you agree with that?
Correct. No, I would. And if in the specific benefit structure, like many employers have started implementing in the last 5, 6, 7 years, that the employee actually might save $5,000 of their out-of-pocket amount by thinking about hopping on a plane and going abroad for care, obviously for non-emergent care, then I think that will help to boost that migration as well.
What are you doing at Companion Global to help these large self-insured employers better educate their employee consumer population?
Great question. I think a lot of times what will happen is that an employer will have have one of the national players as maybe their health plan, and so they believe that they're getting a discount off of charges, if you will. They're saving some level of money from network discounts. It might very well have been that 6 or 7 years ago they implemented disease management, and they're being told that they've got a $3 or $4 per ROI for every single dollar they spend dealing with their asthmatics or diabetics or whatever. 3, 4, 5 years ago, they started implementing wellness programs, and sure, they're documenting that we've lost 20,000 pounds and had 200 people quit smoking, but they're still looking at a 15% year-over-year medical trend increase, compounded. And so a lot of times what will happen is employers will call us and say, look, we keep hearing this something about medical travel. Can you come in and tell us a little bit about it? How does it work and everything else? And so we really try to focus on what we call really the 3 S's: safety first, the whole service expectation that folks can enjoy traveling abroad, and then the savings would be second. And so what we try to do is really just help them to understand that again, we're not advocating for any international hospital, right? Mud huts with thatched roofs and rusty scalpels. We work with 22 Joint Commission accredited hospitals in 15 countries. So really focusing on that whole experience and all, and then the service from being met at the end of the jet ramp to obviously English-speaking nurses to U.S. board-certified physicians to just on and on. And then really work with the employer to help to incentivize, if you will. Certainly, the first step is eliminate the barrier for people traveling abroad. Many benefit plans around the country specifically exclude air travel, for instance, or whether it's ordered by a physician or not. Right. So first thing they need to do is start taking away those barriers, and then, as I mentioned, just waiving deductibles and copays, and an increasing number of employers, primarily self-insured employers around the country, have done just that, and they'll basically say, look, here's the, you might have a $4,000 out of pocket if you have your knee replaced at Hospital X in wherever, pick a state, Alabama, but if you go to SEMA San Jose in Costa Rica, or Bumrungrad International in Bangkok, it's covered at 100%, and we'll give you 2 business class airplane tickets, kind of a thing. So obviously you need to meet clinical criteria and all of that. But so that's what we really try to do is work with employers, and that's what we've had employers that have waived deductibles, have waived copays, have provided up to 2 airplane tickets. We have a couple of employers that actually share savings, so that if the actual employee saves, let's say $50,000, saves the company $50,000 on, say, a hip replacement, that the employer actually will share a certain percentage, whether it's 10 or 20 or 30%, directly with the employee. So as obviously imputable income, so taxes are paid and all that. But sure. So that's one way. We've got 1 or 2 employers that actually will, if they'll actually tell the traveling, whether they're the companion or if they're the actual employee, that for the first week of their travel abroad, they won't make them take vacation time or sick time if they have a kind of a PTO thing. They'll actually say, look, we're so bullish on this. We want to encourage you to do this. We'll pay you as though you're basically working on the clock. And so, we just, whatever the employer's interested in doing, we just try to provide ideas for them to brace to say, and as you point out, a lot of times the questions are asked, well, how much money can we save? Mm-hmm. Well, it depends how aggressive you want to be in your benefit structure.
David, this is Brent. One question that I have, Doug and I have talked about it internally here at the Institute, is there's, with the Affordable Care Act, there's going to be a lot of people coming into the system who haven't existed in the system before, the healthcare system. And, right. Looking at your business, I would think that would be a good thing because now access to care might be constrained here in the States, whereas access abroad, might be more accessible. Is that what you all are seeing, or are you seeing something different?
No, absolutely. And I can tell you that I was actually over visiting some hospitals over in Korea last week, the early part of last week. The folks abroad, many of these countries that really understand and embrace this, at a national level, clearly understand the economics of PAPACA, and they understand that absolutely. If we end up covering an additional, even if it's 20 million people in this country, or in capacity our supply in several parts around the U.S. is sorely strained already.
Right.
Whether it's primary care or specialists. I know in some of the provider groups here in Columbia, South Carolina, where I reside, it might be upwards of 4 and 5 months to get in the OR to have a knee or hip replaced. Imagine if that goes to 9 to 12 months.
Yeah,
Imagine if it goes like in Canada, and this is not rhetoric, but let's say if it goes to 2 to 3 years, kind of a thing. And so, I would agree with you. We think that that it certainly an increasing number of Americans will be looking for alternatives to say, geez, I really don't want to wait. I don't want to medicate for the pain for the next year or two, kind of a thing. And what are some alternatives out there?
And we almost look at, we look a lot at the on-site or the convenient care clinics for, more minor things. But you saw an explosion of those, here in Atlanta. They're almost on every street corner now, and they're building more. So, looking at what you all are doing, I do see the fit with an employer who says, hey, going back to your 3 S's, safety, service, savings, and then look at they're going to have to look at accessibility eventually.
Yeah, absolutely. And again, you on the primary care side, you're absolutely right. So it might very well be, I know locally in a number of the primary care practices in the Midlands here of South Carolina, it might be 3 to 4 weeks when you call your doc before you can get in for a med check, for high blood pressure, for I've got a sick kid kind of a thing. I'm not talking life and death issues, obviously, but again, I think if in every state's a little bit different, but every place from 200,000 to upwards of a couple million people added to the covered insurance in some level, whether through the exchange or what have you, is going to strain that.